Well, man, I'm excited. I can call Anthony a friend, right? You're a friend, right?
Absolutely,
Yeah.
absolutely.
And we met at Health last year. Gosh, last year, guys. And it was just so good to meet you in person and just have some really good conversations. And I was like, I really want to follow back and have you on. So I'm glad you're here.
No, I'm super glad that, yeah, we were able to connect there. It was a lot of fun. Those different events, the pink socks, I always love gifting and taking those fun pictures. So hearing and being familiar with your from past guests, I was like, oh man, I'd love just the opportunity to meet you and further talk. So super excited we were able to come together today.
Yeah. And I know we're going to try to be doing some talks, and I know I appreciate we talked a little bit in the green room. I don't want to throw you off the cliff or some Swiss mountain over your skis on an XX and have you overstate something. But Anthony and I, we were talking, and I was just since you're not a stranger to this word called interoperability. It is a mouthful, not as much as a mouthful as planetary health first, Mars next, but it's a mouthful. And we're thinking that maybe agentic AI might have a place to make it better. And so this conversation is kind of going to just go through kind of if you're starting, if you were going to I guess what would be the right term? Like, I guess not operate or launch a new product launch. What would we call it? Like before going live, doing your due diligence to make sure you get it right. I mean, of course, HIPAA, the patient privacy, making sure there's no agentic gone wild or whatever. So,
Yeah.
you want to give us a user kind of a backdrop, what your thoughts are on that?
Yeah, I think obviously AI has a huge promise in healthcare tech. Obviously, it's all the rage right now, but I think it also has its place for interoperability as well. A lot of interoperability historically is a lot of manual work, right? Like these V2 interfaces, having to map everything takes a lot of time and resources. Whether it's in-house or outsourced, and so it becomes a lot of cumbersome manual work, and that's a lot of money spent for these companies that are tech-enabled services, if you will. So AI really is beneficial. Previously, I was at an org where I called it the boring AI, where they just took all the various sources of information coming in and structured it into one type of proprietary format. So it was hugely beneficial because healthcare data, whether it's HL7, CCDA, and all these other formats, we kind of follow an 80-20 rule where 80% of it is structured because here's what we've deemed and 20% is whatever you feel like. And when you try to do reporting and analytics and all these other things off of it, it's messy. You're losing data and everything else. And so there's this 20% that's just a lot of manual work that has to go into it. So the boring AI aspect was super beneficial in that and helping structure it and getting that into it. Where generative AI, I think, can really come into play is, we were at Health. I can't even tell you how many people I talked to that were doing AI agents. They were all the rage and everyone was talking about it. But it was the first time I heard multiple people come up to me pitching it and telling them the amazing things they're doing with it. All of them claimed to be connecting to EHRs right away without any work, which talking to a person in interoperability is a very wild claim. But I had multiple people telling me this and saying like, no, this is how we do it. This is why it's so simple. If we're able to do that, and obviously you need credentials and everything else, and it's by the rules, I think that helps save a ton of time and money for a lot of manual work on the interoperability front that can be hugely beneficial across the board. My concerns, which obviously there's coming in, is like, what data was that trained on? Is it appropriate data? And if we start getting to other aspects of like, beyond HIPAA and stuff like that, I know there's some regulations coming down about that to make sure consent is part of that. So there's a lot of different factors that go into it, but I'm excited for where this is going from a generative AI side. I would tell anyone that comes to me for consulting on that front, really do your due diligence, find out how it was trained, where that information is living, what clients they've actually done this with and can prove that they've connected to an EHR via this AI and pulled all this information. If all that checks the box, then I'm excited for that. But I would caution everyone to really do their due diligence on that.
Man, I think what's cool I'm hearing, Anthony, is maybe after the show, usually what I always try to do is I do the show, I put it on a Substack as a newsletter, and what we might want to come up with is a quick go live check before you put in your agentic AI or do it to empower interoperability project. This is the 12-point checklist, like,
Yep.
and maybe that could be something we could put out there. What do you think?
I think that would be a lot of fun because I think there's a lot of factors that have to go into play with that. Where I'm at Be Well, there's a lot of work that comes into sourcing data, multiple locations, whether it's from a client, the specialized network that we have that pulling with patient consent in. But then you actually have to aggregate that, map it to FHIR and everything else, and then clean it up. And that intelligence side of just cleaning up, making sure that quality data is there. There's a lot of rules and everything else before you even feed that into some type of AI or LLM, right? All that has to be done appropriately because otherwise you're going to start getting those artifacts. You're going to start getting bad information. You have to follow best practices with that before going into that. That's where we start getting those insights and things of that nature before we start interacting with patients to make it more engaging. Because, now that I'm still part of interoperability, but I'm now with a consumer engagement platform. One of the things that was super beneficial was understanding that you can have all the pretty front end that looks great and everything, but if it's not operating off of comprehensive data that is actually actionable and then nudging for those actions, it's just pretty. You're not going to move a needle on helping patients or anything else like that because you're basing it off of, it's like when we get those notifications in our email, like, hey, it's October, go get your flu shot. Mm-hmm. We all ignore those usually.
Yeah.
But if it's actually like, hey, Anthony, it's been 9 months since you've had this, you need to get this particular either vaccine or you're due. I just turned 41. You're due for your colorectal screening. Like, it's very specific to me and like, here are the reasons why, right? And so if you're operating off of good quality data that's actually to you and then personalize it, that's actually how you help people versus, hey, this is pretty, but it still says go get your flu shot. You know what I mean? Like, that's where I find the true benefit of where interoperability comes into play. And there is an AI component in the middle there, but it has to be done correctly.
I love how you're like talking about mapping it right, like matching it to the person, and yes, get your colonoscopy. That's fun. I can say I did mine. And the prep work, you're gonna enjoy that, my friend.
Yeah, I've been getting a lot of fun warnings. Yeah, I've been told like it's a lot of fun. So
yeah. You're gonna say Rick Ross with the painting. You got to get that right color. Once you reach that color, there's no brown. It's whatever. You're ready to go down. All right. Yeah. They even anyway. Enough about the color. Anyway, it is important, and I think that illustrated a really meaningful point. With making sure you match it with the user, the person, and then connecting it that it's meaningful. So the one thing that I'm curious about, this is kind of frightening. Like when Zuck was saying, like 2025, they're going to have a ton of mid-level programmers, and I can't believe he was heard that he would do that. My gosh, that's what these podcasters they get these little clean moments where and I don't know which one it was, not to pump up whatever on, but it was taken. It could have been a fake whatever deep fake, but I think it was him on some show talking about 2025 where mid-level agents programming would be agentic AI, like mid-level coders. So I don't know. I don't mean to just throw out something there, but that seems to be, if you do these things right, they can really do some amazing things. And I still think if you had what do you have? Someone customer agent just following up with those codes, making sure they're done right. But that's just that is going to be, we're at a point now where these things are coming out, and it's going to be we'll see a lot smaller companies on the dev up and whatnot. How is that impacting healthcare? What do you think? I don't mean to go off topic.
No, I think it's going to be a huge impact. And we've been watching it for a while, especially because I'm in interoperability, and I'm smack in the middle of every type of workflow there is within healthcare that's involving tech, because everyone wants to connect to another system. So I've been in the middle of these conversations for the past 11 years, and we're definitely watching that happen. it's a hard balance, right? You don't want to put everybody out of, or a lot of people out of a job.
Mm-hmm.
However, one of the benefits is if you can automate some very manual tasks for individuals, you could start utilizing the brilliant people you have on staff
Mm-hmm.
to actually do some like higher level work and more engaging work that could probably do a lot better for the organization. So there is a catch 22 of it, is benefit of it. But there's been organizations worrying about this for some time. PwC, I want to say, was like 3 or maybe 5 years ago. They put in a huge investment to start training their employees to like, hey, AI is coming. You're going to probably need to learn some new skills to transition when the time. And so they put a huge investment into their workforce for that. I think organizations need to do that. I was recently talking with the head of a very large organization that's tangent to healthcare. Their AI and compute spend and like, Microsoft Cloud and stuff like that was huge. Like they're one of the global leaders on that. What they told me is they don't really have devs anymore. They have prompt engineers for a lot. They have teams of prompt engineers where they're changing the prompts to look at the data because they just have multitudes of data. So they're doing prompt engineering that's doing that dev work for them, but the engineers are specializing in prompting the system to do this type of task. And so they've shifted their entire business of devs to do that, and it's extremely effective for them. And so I think we're going to see more of that in healthcare. It'll be interesting to see who pivots and who understands that, because here in healthcare we are usually very cautious about that. But I think the more this happens, the more patients, the more doctors and other providers, the more people are going to be demanding like, hey, all these workflows are improving across the board for me as a consumer and me across the board. Why is my healthcare interactions and workflows not matching that same? So I think that demand is going to continue to increase there too.
I like how you said that. It's amazing. I think this is a competitive advantage. Maybe that's a prediction. We've read all these prediction, the 2025 predictions. It seemed like the last 2 weeks of last year, it's all these people writing their predictions and, buy more Bitcoin. Anyway, but, but the other thing is energy. Everything that I'm hearing is this war for energy. Everything from and so if these companies, organizations can really figure out how to leverage AI and their go first to AI with prompt engineers, it seems like they can be very nimble and do some really we're talking like leapfrogging events. So I guess the big thing is you probably want to beef up on the hiring of technical people in the privacy area and the governance area, to get it right, the Anthonys of the world, to make sure you don't just put this out there and you're doing more harm. So it seems like as a strategy, you have to really reimagine how you're going to do your workforce to do it right.
You really do. And I think the energy transition, like, it's seen in a couple of different ways, right? It's a cost, like especially whether it's compute and other things like that. That's going to play a huge factor into it, and so I'm really interested to see where we go with that, because that is going to factor into a lot of decisions of whether it's that brick and mortar location where their data centers are located and how they're doing certain things, and how do they minimize their costs. So if your spend with AWS is so much because of certain aspects of it, there are better ways to store your data. There's better ways to have your data done in a certain way, in essence, taking up less energy. And so all that, I believe, will factor into how we see it. So I think we will see some, I don't know if we'll get to a chief energy officer at a hospital one day or something like that, but I think that will factor into some type of spend at a health system or in other organizations. I think that will absolutely be part of it.
I'm glad you brought that up. In fact, we're in discussion to do more sustainability, and there are about 45 titled sustainability directors at health systems, hospitals. So we hope to be doing some more of that.
That's awesome.
So I would imagine, so what is that job title? It's like this chief AI officers is sort of like with like you said, the energy officer, or whether it be sustainability. Now, where do you find that person? What's their skill set? So that's a challenge, So.
It will be, and it's usually going to be someone that maybe has a little bit of I'm a fan of diverse experience, right?
Hmm.
Of
Hmm.
being able to experience different things. Like I've met so many clinical people that have transitioned into product individuals or more tech, and they are so invaluable to their healthcare organizations. Likewise, you're gonna have someone that had either healthcare experience that went into energy that's going to be invaluable coming back.
Hmm.
You had a gentleman recently, Chris Brereton, that on your podcast, I'm a huge
Hmm.
fan of because he has a lot of that experience.
Hmm.
Those types of individuals, I think, will be absolutely invaluable because you have to know healthcare. If you don't
Hmm.
understand the business of healthcare, you're going to fall flat on your face because it is not like any other industry. And so
Hmm.
you have to understand the levers and what works in healthcare and what doesn't, and understand the entire business of it to actually make the needle move. And
Hmm.
then but someone from healthcare may not understand energy. So having someone that has that thing would be invaluable to an organization like that. So those are the type of
Yeah.
individuals that you're going to want in those.
It's like a unicorn, a purple striped, whatever,
Yeah.
butterflied monarch unicorn. Good luck, right? Finding this. Yeah.
I will say and you've had some other interoperability people like Brendan and stuff like that in the past.
Yeah.
Like we're humble enough, we won't call ourselves unicorns, but we're often called those because we're solely in the middle of everything happening that we have a good understanding of what's happening around us. But we're also so niche in where we are with what we do.
Yeah, I tell you, so with the solar, like I was telling you, the family farm that we're working on, my cousin
Yeah.
has a solar farm. I learned so much doing the biz dev on that. I never knew before doing this. No one knows where electrons come from. Okay, so it's contractual. Everything's contractual. You don't just plug in your power, and these electrons are coming from whatever coal-fired plant. I mean, it's
Yeah.
really that's what's so fascinating about it. So it's very opaque, but it's also opportunity to create more value and alignment. And then when you actually get to that substation where the power comes from, wherever it is, um, I think to your thing that you mentioned about AWS, about the massive amount, the lock in, or whatever they call it when you get in with the product software, you can't get
Yeah.
out. I think you're going to see so many emerging, really super nimble techs that are coming in that are like, it's like where we said on-prem for cloud or off.
Yep.
I think there's going to be some really interesting companies that are emerging in 2025 with this. I don't want to, I'm not mentioning politics, but there was some real stopping, holding with the fintech, the crypto
Mhm.
companies. And now obviously there's a signal that there's a lot more openness to
Yeah.
try some stuff. So I think how that intertwines, and I'd love to have your thoughts on that in healthcare. What's your thoughts on that?
Yeah, I think there's a couple factors there. Going to your point about like the on-prem, off-prem, colos, and cloud, and I'm wondering now we'll have space, above the cloud. So if we're going beyond the cloud, we're now in space of how we're transmitting and where we're storing everything. You're stored in the infinite, right? I'm pretty sure that'll come out at some point in the near future. Without getting political or anything like that, I think it's always hard, especially being in the interoperability side. Every presidential election cycle for the past 15-20 years, there has just been so much change
Mm-hmm.
that we watch our industry kind of halt for a bit and try
Mm-hmm.
not sure, like obviously with ACA happening, like that was a huge transition when I was in med device. We always see with every potential election, especially if it switches from one house or one side to the other, you're not sure where that next group is going to go and if that will affect Medicaid or
Yeah.
Medicare,
Yeah.
if it will affect where we're going with information blocking. And so
Mm-hmm.
there's always this pause, like we saw a pause in this last election cycle of everyone not sure. So I think I am hoping that we see that openness of pushing forward mandates of more sharing, more innovation. I think that where healthcare is always cautious and with good respects is you have a lot of people from outside healthcare and even some people who are selling the snake oil, the
Mm-hmm.
vaporware.
Mm-hmm.
And
Mm-hmm.
groups have been burned significantly by that. And so there's always that caution of the big promises, right? Of everything. And you're cautious because AI can do so much and I'm so excited for it.
Mm-hmm.
But there's a caution for a reason because we're playing with patient information. And if that changes the diagnosis and it was found to be hallucinating or something else like that, you want to make sure you have all your ducks in a row. And sometimes these groups from outside of healthcare that are walking in promising to transform it that don't understand it, there may be some lack of best practices coming into it that may affect a patient life. So that's where the caution comes from. And I've met a lot of the snake oil people, the vaporware people over the years, and you can spot them, but their pitch is so good. So I think I'm excited for the push and the opening of it. My only concern is, does that open the door for the bad actors to try and come in or further thrive? And I think that's where, going back to our original point where we started, due diligence has to be done
Yeah.
for this, not in the promises of future, not in the promises of saving money, but to make sure it is the right organization doing the right things.
Yeah, I think it's so hard. Why I say that is there were some super smart people, and I'm just using an example. One of the biggest frauds, FTX, the
Oh,
crypto, Sam Blanken-Friedman. There was super smart people that gave that guy plenty of money, and so I think the scary thing is the ones that are super smart, and whether they're negligent. I don't want to get all into that. I read the Michael Lewis book on it. It was
mhm.
he's a great writer, great storyteller on that. And sometimes the jury's out. Did the person know? I don't know that one, and that's not really for this case. But I think sometimes the people that are doing vaporware, all their stuff that's written, whether they're frauding Medicaid, they do the best paperwork. They have all the best. I mean, I hate to say it, that's the scary stuff. So I think it requires people like you and the teams that you're with that how do you do that? Like because they're like, it's almost like the hackers, that the bad actors are almost more intelligent, and their pitches are even so. I don't know. Any
Yeah.
thoughts on that? That's what's scary.
Yeah, there's always, I've come over the time because I may have worked at one of the bad places and left quickly, because you don't know it until you're there sometimes. And
Mhm.
then, well-intentioned people that sometimes they got in over their head with funding, and now they're beholden to their investors to continue to make some wild announcements or things that they're capable of doing that they're incapable of doing. And all of a sudden they're like, well, for us to keep this alive, to keep the dream alive of where we intended, we're going to have to do some bad things to get there. And does the end justify the means? Like, all that comes into
Mhm.
play. And so it's hard to watch. I think, yeah, I think it really does have to go into doing due diligence, really understanding what it is you want, and make sure what you're bringing up is kind of like, some organizations are really good about teaching the test. They
Mhm.
learn what the test is. Oh, these are the metrics you're
Mhm.
interested in. Okay, I'm so focused on the metrics, I can't deliver on anything else of value, but I have all the metrics that you're looking for. That's sometimes where organizations find themselves, like, hey, they helped us with all of these, so they must be great, and let's
Mhm.
invest in it. And all of a sudden they mess up everything else behind the scenes. So it goes back. I think I'm really just about due diligence. Honestly, it
Yeah.
really
Yeah.
has to be done. Really understand their SOP. Don't go into trust me, bro. That
Mhm.
no hospital,
Yeah.
no vendor contract should not be done on a trust me, bro.
Mhm.
I feel like I've seen a lot of those throughout my time, because you have a very charismatic C-suite
Mhm.
that's just shaking the hands, and
Mhm.
that's not going to the other stuff that I've
Mhm.
seen in the past. But they're, I think really having the right people with experience study those contracts,
Mhm.
study the software, is really important to making sure you're getting with the right group.
So tell us, 2025 is, we're still sort of, there's plenty. Don't I mean, I don't know if you've done your predictive letter or whatever, or what are you thinking? What are you excited? Like, would you like to see more of? Where are some opportunity for healthcare? And then the second take is, I'd love to hear a little more. Be well. I'm
Yeah.
excited for you. You're 90 days in. And so the first take is sort of where you're seeing 2025. What are you excited for? And kind of tell us the Be Well story, and how you being there and doing well there.
Yeah, I think I'm being well. I think for 2025, where I'm super curious on is pulling on that thread with the AI agents.
Hmm.
I really want to see if they can deliver on a lot of what I'm hearing for, because if that helps on a lot of fronts, of just a lot of manual tasks that can be done either for a patient or by a patient or other aspects of that, and connect and going to the interoperability side, I'm really excited for that. Like, when I heard that at Health, I want to see it happen. I know B will have some cool things that they're working on that front as well that I can't talk about yet. But there is some really fun things when it comes to the promise of it is so good that I'm excited. But I also know, like, having B here at Be Well, you have to do things the right way to make sure it is effective. But also, there's a lot of rules in healthcare that we need to follow, and that it has to be done that way. Be Well itself, I'm loving. It is so much fun because I knew they were a consumer engagement platform or customer engagement where they work with patients at a health system or a member at a payer, but it's really consumer focused, which is a departure of interoperability. But what drew me in was their interoperability strategy rivals the best HIEs out there. And that's what got me excited, because they're taking information from their own system, from a client system. Be Well itself has like this unique network of like 60,000 plus different connections to payers and EHRs and everything else that allows them to really collect a lot of information and bring together of a patient, but then individually engage them. And so it highlights care gaps, it goes through all these other aspects, but then learns exactly the patient actually engages. They prefer email, not just because they checked a box, but because they actually engage the most with a video over email. And that right there, they are saying like, so now future content, when it's delivered to them in that way, that is the biggest promise of engagement, and tailored to actually, Anthony, this is time for your colorectal screening and stuff like that. And so it's very tailored to each individual. So you're taking a very large swath of information, bringing it all in, and then getting a lot of insights, and then engaging at each individual level. I love that. And they have, BO has all these different metrics of like moving the needles, of helping close care gaps, helping get a lot more screenings, making scheduling easier. So that way everything can be done just through your phone. Like, I'm going to schedule for this appointment, do this, that, and the other. So that part's a lot of fun. I get to be kind of in charge of more of our new interoperability offerings, where I'm focusing more on the stuff we do on the back end, because what we do is like an HIE, but it's a managed service of all that. So all these connections aggregated, mapped, cleaned up, all in a single longitudinal history, but with a lot more information. And you don't have to have teams of people doing all that. You don't have to have teams of vendors to implement a CDR, an integration engine, an EMPI, and analytics. All of that is what is available in a box. And I get to help bring that out. So I'm super excited because I get to use my interoperability strengths here, while still on the other side working with payers and health systems to engage their patients as well. So I get to have a lot of fun here.
Yeah, this is awesome. And I remember talking to you pretty early. I think at Health, you were like just literally
Like
just
2
got
weeks in.
hired within that. Yeah.
Yeah.
And you really, I remember it was a very powerful statement where you share with Kristen just the real deal, how she did, because there's so much lip service to how you're different as a startup founder and company. And what I'm hearing is a really integrity driven individual company that really wants to keep trust is everything. Trust everything to the patient, that consumer focus, and trying to do it differently. Whereas too many companies, not to mention any, I don't like shaming or bad mouthing, but kind of say one thing and do the other. And it sounds like you're at a place that's really trying to keep that fortress of trust and just build on that. So
yeah, Kristen, it was funny. I followed her on Twitter forever. She followed me too, and we ran into each other at the LA Vive last year. And she came up and just gave me a big ol' hug, and she's like, "I love your interoperability stuff. Like, if there's ever a moment that we can work together, I would love to work with you one day." And the feeling was mutual because, like you said, she seemed on paper and in interviews to have a lot of integrity, and her story is powerful. And now that I've had time to spend with her at Health and here at the company, I'm a big fan of, don't go work for a logo, go work for a leader, right? And then find the leader that inspires you, that wants to do. There is no better person to have in the room with you than Kristen. Like, she's very, her background, she was in the payer space as an executive for years before starting Be Well. I won't go into her whole story, but she has a powerful story where her daughter has a complex medical challenge, and they were trying to get a diagnosis and trying to get the medical records, trying to navigate the healthcare system, payers, everything else was such a big challenge that after a year and a half, she's the one that ended up finding the diagnosis after fighting all that, and said, like, no more. exited the payer that she was at that ended up getting bought out or was bought by United and stuff like that, and started Be Well, saying no other patient or family should have to go through these struggles. I want to make it better.
Mm-hmm.
And but she understands, as we talked earlier, it can't just start a PHR. I love PHRs. I've helped on so many PHRs, but their business models are harsh and they're hard to sustain. Kristen knew that right away. She's like, we are in the business of healthcare. If you actually want to affect change for patients and make it better for them, you have to know how the system works and have a business model that can allow for that. And so she built that from that and has said, look, if we're going to be super helpful for patients, we have to understand interoperability early on. So interoperability has always been part of what Be Well does. It's just not advertised. But that's why it's so strong. And so every time I'm in a room with her, I'm like starstruck because of how engaging she is. She really knows the business. I jokingly say she's the quintessential. She could sell a snow cone to a snowman in the Arctic, and 100% they needed it because she's just so charismatic. But because the power and the experience that she has, and she obviously wouldn't do it unless the snowman actually needed it. But in the same respects, like it's just an amazing personality to be there with, and so super happy to be like learning from her on that front.
Yeah. Well, that's an awesome story. And I know she's really excited to have you because you're, like I said, in the green room, it's just solid. It's great to meet you at Health, and just, you're a solid person. And, I love, I want to go long and far with good people.
Yeah.
And that's why one of the reasons for sure why I wanted to have you on today. You're super smart and you care what you're doing, and and I think it's reflective of you being, it being good things with Kristen, but good things with you. And that's why you're, with Be Well. So, anyway, I'm really glad you came on today. I know, I kind of threw you to the wolves today because we didn't, I mean, you just came on and we
No,
kind of,
yeah, I know. I love these conversations, and yeah, I love that it starts here, and then sure enough, we'll end up in Mars, right? As the name suggests. So I love starting here, and then looking forward. I appreciate the time, and looking forward to actually hanging out at Vive and everything too, because it'll be fun to catch up there and see what other innovations are being presented there.
Yeah, no, absolutely. I'm looking forward to it. Nashville's a special place too. I think that's going to be fun. And so anyway, is there anything that you want to say? We're wrapping up in a minute or two. Anything while you're here? Last minute?
No, I just no, honestly, I appreciate again you. For others who are listening, be kind to those in California right now. I'm in Southern California. While I luckily haven't been affected directly by the fire because I'm just a few miles south of it, a lot of my childhood that I watched got burned down. And so kindness to those in California, regardless of your political beliefs or anything, because we see a lot of that on social media right now. There's a lot of people hurting, and a lot of workers who had to have pauses last week and stuff like that, and had to cancel certain things. So I'm hearing stories of legal teams that were being pressured while they're losing their home to deliver on certain contracts. Nothing at Be Well or anything like that, but like a lot of people are posting of like, have some empathy for those who are going through a lot right now. That'd be my only message, just because it's been harsh to hear how people are being treated because of where they locally live.
Yeah. No, it is a sheer tragedy, nothing short of tragedy. And it's just so massive, just a massive. And so thank you for bringing that up. And my prayers to everyone there, and glad you're okay and your family. But geez, it's just it is cataclysmic. I mean, it's just nothing we've seen this massive on the scale. So I just hope there's some more. Yeah. Anyway, that's beyond But anyway, appreciate.
Not to take it down there. It was just more. I've watched a lot. Like again, I wasn't affected, but my childhood, where I proposed to my wife, was burned down. Where I grew up, my dad was a postman. His post office is gone for 20 years, and that was a neighborhood I was a part of. So like a lot of my history, I watched on the news burn down. So I'm luckily safe.
Yeah.
But I have family members that were affected and lost. We know people in healthcare tech that have lost homes and stuff like that. Like, it's really tragic. And so for those who have political leanings, leave those at the door and just check on your people, check on your friends, offer the support or just warm love to them. That's what we need right now. Not any type of who to blame on it. Just check on them first. That's the most important thing.
Yeah, thank you for that reminder for human to human. So
Yep.
awesome. Well, thanks for coming. And
Yeah.
until next time, and we'll see you at Vive.
All right. Sounds good.